So we are going to we're going to scan for the models today. First thing we do is put the Optrogate in. First you wet it. Then you pinch it in the middle. Put it in on one side and then you just work it around to get in on the other. This is a little tricky. Good, and the tabs are going to be on the bottom. What that's going to do is just retract your lips, because these lips will get in the way of your scan. Perfect. Okay. Next thing we're going to do is go over to the Primescan. We're going to select impression. Next. All right. So Peyton, you like to start on the top or the bottom?
Top is easier, so you can start on the top.
Start on the top because it's the easiest one.
And you always want to start with the scanner in the mouth. Turn your scanner on and start lingual. Open really big. There you go.
All right, and which part of that screen are you looking at?
You're only looking at your live screen. So which is, your live screen is right here.
Side. Okay.
This is your live feed.
Yep.
So you're going to capture only your lingual and you're missing a lot of data, and that's okay. You're going to stop the scanner and then you're going to come more occlusal and then you'll grab your buckle.
Mm-hmm.
Open with a rod. So you're hovering over all the teeth here. Going back to grab all your occlusal portion. Open really, really big. Alright. And then I'm going to stop again. Let the scanner load, but again, I'm still looking at this section only, not this section. And we kind of glance and look. And now we're going to go back and grab all the cheek area. And you're going to grab all your buccal surfaces here.
So how are you holding the Primescan right now?
So I'm left-handed, so it's a little bit different, but regardless, you've got your scanner in your primary hand, and you notice my non-dominant hand is here, so I kind of just use it to guide along and help me, so that way I don't touch or bump any of the teeth. So not only is your dominant hand important, your secondary hand is just as important because it's guiding you along. It holds you also steady and accountable, that way you don't have any disruptions. Especially around these incisal edges, it gets a little tricky. So you're kind of want to grab your images and stop. You are being fluid when you're scanning because you're moving that secondary hand along with it, but you want to make sure you're not over scanning. That's why you're stopping and starting. You also want to make sure you capture a few millimeters of the gingiva as well. And then we're missing a little bit of data along her posterior molars, which is okay. We can go back and grab.
Mm-hmm. So just to recap, we go lingual, occlusal, then buccal, and then you just fill in all the missing data that you have.
Right. So you're going to stop and start when you're grabbing this data because, again, you're trying not to overscan. It's important to stop and start, especially when you're at the last phases of this. You can get a lot of data which could cause your scanner to overheat, and then it won't work and function properly.
Mm-hmm.
Open real big. The trickiest part will be the distals of your second molars, so like 2 and 15 on the top will be tricky to get. You can get it, but there's certain angles in order to achieve that, which may require you to take the Optrogate out. We'll do that at the very end. So for now, we've sufficiently captured enough data that where we're comfortable we'll take the objugate at the very end and grab the distals. But let's move to the lower and grab that. So same pattern on the lower. You're going lingual. Stop your scanner, let it load for a minute. You're gonna come back and grab the occlusal and then grab the buccal.
Yep. And you're not putting that tip on the teeth, right?
Nope, you're hovering.
You want to be about 5 to 10 millimeters away from the teeth, just right on top. You can see on the lower, there's a lot more variables, there's a lot more saliva, her tongue in the way. And so sometimes you have to retract the tongue when you're doing that.
That's where your secondary hand comes important, as well. You can do 2x2s. You can spray air, but a lot of times, especially if the patient is not numb, they can be sensitive to that. So you want to keep your 2x2s. You can even ask the patient to kind of pull their tongue back to their throat. But now that we've captured the majority of the lingual, the occlusal, I'm coming back through and grabbing the buccal. Again, when you come to this anterior area, you're going to have to stop and rotate your wrist. And coming through the anterior there. And like I said, the objugate is very helpful, but it kind of impinges you on your posterior molars, and that's okay. You can come back and grab them, because you're gonna also, well, you can probably leave it in for the bite. Bite together like normal. Good. Sometimes it'll pop out like that.
Yeah.
I knew that was coming. Sorry.
Once it pops out, it's good. Then you just gotta do a little bit more retraction.
I need to do some restoration.
Bite together like normal. So anytime you're doing a full arch, you're gonna grab the bite on both sides. Have the patient bite down first, find their bite, then start. So you got your buccal bite on the right side of the patient's mouth. If you notice, the screen should bring it in. So like in that instance, there it goes. So you see your hover images coming on each side. But since you're doing a dual arch, have her bite together again. You need to technically capture on the opposing side as well. Opposite side, sorry, not opposing. Opposite side. Should capture. Sometimes you have to go over back to where it found out and then kind of wrap around the anterior.
Yep, and you can kind of go, you can go premolar to premolar if you want to just go straight across.
So now that we've got basically everything we need, I'm gonna jump back up to the top, grab the distals here, looking real wide.
And just see, pay attention to how she holds that scanner when she's on the distal of the second molars.
You're kind of rocking the white part away from you to grab that distal area. And then also, like I said, don't try to overscan. And then we need to do the same thing on the right hand side. And again, you can tell the patient to close about halfway. So see how when she closes, it makes her cheek stretchier. And we rock that white part away from us. We come back up here and grab that little spot right there. Good. So we'll come back down to the lower as well, do the same thing. My secondary hand is important here because, go ahead and open. When I do, I either have my finger and my index or my middle and my index retracting her cheek as well as her tongue. So I'll get another 2x2, dry this off really well. And then I'm gonna slide this in real wide. There you go. And I'm gonna start lingual again because I'm missing that second molar. And then grab it. And I'm able to roll my wrist over. If you're not able to roll your wrist, that's fine. Just stop the scanner and come back to it.
As you get more comfortable with it, you'll be able to do more rolling and be a little bit more fluid.
Same thing, dry it off. Secondary hand has her cheek out of the way. We're also starting lingual again. Going posterior. And again, I'm rolling my wrist over, but feel free to stop and start, stop and start. It's okay, because you've already done the majority of your fluid motion in the beginning. So you're good. You actually know what your scan really looks like next in your model phase. So as of right now, you should be good, but you'll be able to tell next phase for sure.